Thank you, thank you, thank you. I'm so glad to be here today. And thank you everyone for tuning in. And I also want to give a thanks to the Community Health Training Alliance, as well as the Philadelphia Fight community for this fantastic opportunity. And so just like it was discussed, my name is Dr. Marcelin. I am a podiatrist, and I'm the director of the Community Outreach Division of the Save Your Souls campaign. And I have the pleasure of giving you this lecture on racial and gender disparity in lower extremity amputations in Philadelphia. All right. I wanted to just touch upon the concept of amputations. Philadelphia has an amputation problem, and residents of Philadelphia are 2 times more likely to lose a limb to diabetes than residents of the surrounding counties. To make matters worse, Philadelphia has a much higher prevalence of diabetes in other areas. So this particular slide depicts the geographic disparity in major lower extremity amputations within the southeastern corner of Pennsylvania. Major amputation is defined as an amputation at the level of the ankle and above. Females in suburban counties have relatively low amputation rates in comparison to females in the city of Philadelphia. However, the trend within Philadelphia is decreasing consistently. The overall rate of major amputation in the United States is 22 individuals per 100,000 individuals. Females in the suburbs of Philadelphia are well below this national figure. More recently, females in the city have surpassed that benchmark, so they're getting better. The rates are getting better. Now, when we look at this graph over here, in the dark purple listed above is the rate of Philadelphia. And then these below, we're looking at Bucks, Chester, Delaware, and Montgomery County. So we're seeing that there is a discrepancy between major amputation rates between Philadelphia and the surrounding counties of the Delaware Valley. Now this slide, what we're doing is we're going to be looking at the same statistics. However, we're looking at the males. The rate of major amputation suffered by male residents of the Delaware Valley by county, again, Bucks County, Chester, Delaware, and Montgomery. And what I wanted to do is I wanted to note the lack of progress in Philadelphia from 2005 to 2014. Now, if we remember back to the slide with the females, there was the females for individuals in Philadelphia, which is this big dark purple line, that trend is generally trending downwards. However, for males, it's going up, it's going down, but the most recent statistics of which I've looked at ends in 2014, and that bump is going upwards. So there's an upwards trend. The suburban counties of Bucks, Chester, Delaware, Montgomery have low rates of major amputations in comparison to Philadelphia. Again, Philadelphia is this dark trend at the top. And males in Philadelphia have a rate that's twice the overall national rate. So again, the national rate for major amputations is 22 per 100,000 individuals. And when we're looking over here, for the males in Philadelphia County, we're looking pretty close to around 50 per 100,000 individuals. This slide depicts the actual number of major amputations in Philadelphia and the surrounding counties. Men have demonstrated no significant change over time, while females experienced a steady, modest decline. This slide also depicts the total number of major amputations from all causes of diabetic patients suffering over 80% of the limbs lost. Most major amputations result from a triad of poor circulation, infection, and loss of feeling in the patient's feet. Black men lose limbs more often than any other segment of the population. This slide depicts the racial disparity in major amputations in the Delaware Valley. In fact, racial disparity in amputations was first reported nationally in the early 1990s. African American patients are twice as likely to suffer limb loss than Caucasian Americans. In this slide, we're breaking it down between males and females, as well as African Americans and Caucasians. And just like I said before, Black men have rates that are pretty much twice that of Caucasian men. And when you're looking at African American females, the same thing applies. African American females have rates that are pretty close to twice that of Caucasian females. This leads us to ask a very important question. Why does Philadelphia have a greater incidence of major amputations in comparison to surrounding counties, and why are Black men disproportionately affected? Well, when we tried to answer this question, we basically broke it down to three main bullet points: socioeconomic status, diabetes as a disease, as well as cultural aspects. Regarding socioeconomic status, residents in Philadelphia tend to have a lower socioeconomic status than residents of surrounding suburban counties. The median household income in Philadelphia, as of 2014, was approximately $26,789 in comparison to the median household income in the suburbs of $66,235. In regards to diabetes, diabetes is the disease which is the leading risk factor for major amputations. Diabetic prevalence is higher in the city as opposed to the suburbs. Males in all communities have a higher rate of lower extremity amputations in comparison to females. In fact, this is true in Japan, Italy, England, and the United States. Men are less trusting of medical institutions and providers, it seems. They typically tend to go to the doctors less frequently. In fact, this is more pronounced in the African American community. Historical reasons, cultural reasons may contribute to this observation. However, this is what's going on. Now, in this slide, I wanted to bring about a specific ailment that individuals have come to the hospital in reference to secondary causes of diabetes. So what do I mean? Gangrene. So gangrene is dead tissues caused by an infection or lack of blood flow. In the Delaware Valley, 20% of patients who presented to the hospital with gangrene were white, and 40% of patients who presented to the hospital with gangrene were Black. This is lower nationally. It's lower in comparison to nationally in the Delaware Valley, which is great. This is telling us that in the Delaware Valley, we are doing well when it comes to decreasing individuals with gangrene. However, this statistic is also showing us something that's very important. Uh, Individuals who are Caucasian with gangrene versus individuals who are African American who have gangrene, there's a two times discrepancy. So, in the Delaware Valley, 41% of individuals who presented with gangrene were Black, and 20% of individuals who presented with gangrene were white. Black patients in this area presented for admission to the hospital were double the case as comparison to white individuals. So of this, I'm just showing 60% of individuals who presented with gangrene, but the remaining 40% consists of Hispanics as well as Asians. However, we don't have that census data just yet to give you the specific breakdown of those numbers. This slide depicts the high rate of amputations in the diabetic population in comparison to non-diabetics. The top panel is the total minor and major amputations in diabetics in the United States, and the lower panel is the same data for non-diabetics. Please note that there's a suggestion that amputations in the US diabetic population may be trending downwards, or upwards rather, after a decade of decreasing numbers of amputations. So when we're looking over here, we're going from 2000 all the way to 2015. Initially, the trends were trending downwards. However, as of late, it looks like these trends are starting to tick back up. All in all, Philadelphia has a very high prevalence of diabetes. Now, what I wanted to talk about in this slide is the comparison of Philadelphia as a region versus other major metropolitan regions throughout the United States. So West Coast all the way to the East Coast and in between. Now, what we're looking at is just another way of showing that Philadelphia has a really big prevalence of diabetes. And something needs to be done in order to help decrease that trend. What we're looking at over here is the adult diabetic prevalence within the city of Philadelphia itself. The prevalence of diabetes is 16% in the city of Philadelphia, meaning of the individuals in Philadelphia, 16% of those individuals has diabetes. In fact, 19% of African Americans in the city has diabetes. The areas with the highest rates of diabetes are being shown on this slide, where in red shows the higher areas, whereas in green, it's the lower areas when it comes to the prevalence of diabetes. The areas with the highest rates of diabetes, like Strawberry Mansion, Mill Creek, happen to be some of the poorest and some of the city's most segregated, with 95% plus Black populations with a median annual household income ranging from $15,000 to $25,000 a year. Now, the beginning portion of this discussion just talked about the statistics behind the regions that has a high prevalence of diabetes, the groups of individuals who have high prevalence of diabetes, just to set the tone of what we're dealing with. What I wanted to do is also talk about some of the effects of individuals who have diabetes, starting with poor circulation. Poor circulation, which is also known as your blood flow, can make your foot less able to fight infection and to heal. Diabetes causes blood vessels of the foot and the leg to narrow and harden. This is known as peripheral arterial disease. This is something where we need to make sure that if you have poor circulation, you need to be checked at least yearly for circulation problems. Poor circulation develops slowly and often silently. This is a depiction of plaque buildup in the leg, with which results in less blood flow to the foot. The decreased blood flow can result in delayed healing. This leads to infection and gangrene. It's also important to remember this loss of blood flow to the foot is silent. Sometimes an individual who has poor circulation doesn't exhibit any symptoms until late. What's neuropathy? Although it can hurt, diabetic nerve damage can also lessen your ability to feel pain, heat, and cold. Loss of feeling often means you may not feel a foot injury. Something that I like to tell my patients when it comes to neuropathy and when they have questions about neuropathy is this little scenario. So an individual who has good feeling in her feet, let's say you're walking down the path and a little pebble, gets lunged into your shoe. Individuals who have feeling in their feet, that little pebble over time will probably become annoying to the point where you stop, you take your shoe off, and you remove that pebble. Individuals who have neuropathy may not be able to feel that little pebble. And if you can imagine putting 100% of your weight, step after step, over a series of long amount of time, that little pebble could have that propensity or that ability to cause a little wound on the bottom of the foot. Now, if you have neuropathy and if you don't have feeling, that little wound may get exacerbated and may get worse, leading to something bigger like an ulcer. That ulcer has a propensity of getting infected. So you see this general trend of what I'm saying. The loss of feeling in your feet is extremely, extremely important to know, number one. Number two, if you have that, it's important to stack the odds in your favor. Do things that will help you not get infections, and you need another set of eyes, so to speak, to help you. And that's where podiatrists come in. The skin of diabetics tends to get drier in comparison to non-diabetic patients. Dryness itself can contribute to callus formation and skin breakdown, leading to ulceration. In order to prevent this, it's important to use a form of moisturizing agent to improve the feel and the integrity of your skin. Some diabetic patients may not feel discomfort caused by a callus, and the extreme pressure caused by the hardened tissue may cause the surrounding skin to blanch as it fails to receive adequate blood flow. If hard enough, the callus may eventually form an ulcer, or it may open as a sore, as seen in this particular individual. The breakdown in skin may allow bacteria to enter the foot and cause an infection. As a result, it is in our best interest to heal this ulcer as soon as possible, because if that ulcer stays present, it has the ability to increase in nature, and the chances of infection increases as well. There are several means by which a podiatrist may assist in reducing the pressures. There are several means by which a podiatrist may assist in reducing the pressures which have led to callus formation. Although there is probably no conservative method which will totally prevent calluses from returning, the rate of formation and thickness may be improved by a variety of methods. What we're looking at over here is or are pictures of diabetic patients with chronic callus formation. Just like I stated before, callus is a buildup of hardened skin. If these calluses remain, buildup can exacerbate and get bigger. If it gets big enough to the point where it gets caught on things, say the top of your shoe, socks, or even garments or clothing, it has the ability of getting ripped off, leading to open sores, open lesions. Calluses in itself forms from pressure buildup. It's your body's way of trying to offload the pressure. So initially, the body grows extra skin to pad off that pressure, so to speak. But eventually, if that region has so much skin buildup, it itself would exacerbate that pressure region, making things worse. So a way that I like to think about it or tell my patients about it is, let's say you have a natural propensity to put a certain amount of pressure on a certain aspect of your foot. Let's say the plantar aspect of your foot underneath your big toe, your hallux toe. If you naturally have higher pressure region in that area, your body is going to naturally develop calluses because it's its way of trying to buffer off that pressure spot. But over time, that pressure spot will increase, and it's kind of like stepping on a Lego. If you're stepping on a Lego piece, that one focal spot will cause an immense amount of pressure on that one little spot. And so the amount of pain that you get from that region can also increase. As podiatrists, we have the ability of relieving that pressure, relieving that pain, also relieving the propensity of potentially getting a wound secondary to that pressure region or lesion from being ripped off, causing a wound. Calluses. Calluses occur more often and build up faster on the feet of people with diabetes. Therapeutic shoes may help. Calluses, if not trimmed, get very thick, can turn into ulcers or open sores. Never try to cut calluses or corns yourself. This can lead to ulcers and infection. Let your healthcare provider cut your calluses. Also, do not try to remove calluses or corns with chemical agents, as this can also cause more harm than good. Here we're looking at a picture of a podiatrist checking for the pulses of the foot. There's one major pulse on the dorsum or the top of the foot called the dorsalis pedis, and there's another one on the side of the foot called the posterior tibial. The presence or absence of these pulses is one way to determine the status of the circulation of your foot. It's extremely important to know your circulation status. Once again, the foot is the appendage that's the farthest away from the heart. So it has the propensity of having the least amount of blood flow. Blood flows through the heart to the arteries, and then it comes back through the veins. And it's important to make sure that the arteries have the ability to bring good blood flow all the way down to your lower extremities, because having good blood flow will increase the chances of individuals from being able to heal whenever some sort of ailment comes about. Do not use tobacco in any form. As a healthcare provider, we always, always, always want to belabor that concept, whether it's smoking tobacco, chewing tobacco, any form of tobacco will decrease the ability of your lower extremity vessels from working as well as they possibly can. Nicotine causes constriction within the vessels and it reduces circulation. Walking is one of the best ways to provide good, healthy blood flow to any patient, whether they're diabetic or not. It has the ability to increase the quality of blood supply to the foot and the leg. Although this will not repair any vessels which have already been damaged, it will make the remaining vessels more efficient. Exercise, such as walking, may also have beneficial effects upon the blood sugar levels, and it's also very good for the heart. So what are some more things that we can do to help individuals who have diabetes? Well, diabetic control is something that we could strive to attain. One of the things that we can do is, if you're diabetic, ask for something called the A1C test, hemoglobin A1C test. This test measures your blood glucose, and it's a test that averages 3 months of your blood glucose. It lets you know if your blood glucose has been under control. So a number that we want to strive for, what we want to aim for, is less than 7%. Now, I'm going to be going over something called the ABCs of diabetes control, and the A is the A1C test. So with the ABCs of diabetic control, B goes for blood pressure. The higher your blood pressure, the harder your heart has to work. It's important that you get your your pressure checked at every doctor's visit. And the specific number that we want to aim for is below 130/80, systolic over diastolic pressure. Within the ABCs of diabetes control, C stands for cholesterol. Bad cholesterol, or LDL, builds up in your leg, or it builds up and it has the ability to clog your arteries. Make sure you get your blood cholesterol tested at least once a year. And the number that we want to aim for is below 100 mg per dl. Within the ABCs of diabetes control, D stands for dental care. High blood sugar can cause problems with your teeth, your gums, and your mouth. Make sure you brush your teeth with a soft brush and floss after meals. Check your teeth and gums every day for problems. Make sure you call your dentist if you have sore, bleeding gums, or white spots, or a bad taste in your mouth for more than a few days. These are the signs that can be telling you that you may have an infection. Within the ABCs of diabetes control, E stands for the eyes. High blood sugar can cause a number of problems with your eyes, of which blurry vision, cloudy vision, increased eye pressure, or even loss of vision. An extension of the E for your ABCs of diabetes control is eat healthfully. Maintain a healthy diet. So what we want to do is we want to eat less sodium, saturated fats, trans fats, cholesterol, and sugar. And we want to eat more of fibers. So that can be done if we choose whole grains, vegetables, fruits, beans. A healthy tip would be to add a piece of fruit to your lunch. You can even add vegetables, beans, soups, and casseroles. we want to make sure that we aim to stay at a healthy weight. Within those ABCs of diabetes control, F stands for foot care. Here are some common things that you can do to help manage your feet. You can wear white socks. You can check your feet daily, especially the bottom of your feet. You can go ahead and see your podiatrist for general foot checkups. Let's try to keep our toenails at a manageable level. In fact, podiatrists are glad to manage your toenails if you have difficulties doing so. Let's aim to moisturize our feet daily. Let's just make sure that we don't put any moisturizing agents in between your toes, because those are the areas that typically moisture builds up and can lead to skin breakdown in between the toes because of the moisture buildup in the damp areas. So let's moisturize our feet, but refrain from putting moisturizing agents in between your toes. We can make sure that there's no calluses or thickening of our skin, the top and the bottom. We can work on not walking barefoot. We recommend, putting on sandals, wearing socks. Wear comfortable, supportive shoes. Also, we need to make sure that there's no sores or open lesions to the bottom of our feet. Very, very important. People with diabetes can develop many different foot problems. Even ordinary problems can get worse and lead to serious complications. Foot problems most often happen when there's nerve damage. We discussed this before, but as a reminder, this is called neuropathy, which can lead to loss of feeling in our feet. So in summary, diabetes is the leading risk factor for limb loss. Black men in Philadelphia have a disproportionate amount of lower extremity amputations. Education, we believe, is the first line of defense to combat amputation rates. And last but not least, let's remember those ABCs of diabetic control to help decrease amputation rates. If you're diabetic, be sure to schedule a visit with your podiatrist. Routine diabetic foot checkups can help slow down the progression of diabetic foot infections and even amputations. Together, we can help manage diabetes and decrease amputation rates. Questions?
Wonderful. Thank you so much for that, Dr. Marsland. So while our audience, actually someone raised their hand. So Shali, let me actually try this. Shali, you have the floor. What's your question? All right, Shali, if you would type in your question. Oh, there we go. Awesome. So can you show the slide before the summary slide, please? I think someone wants to revisit that. Awesome. So this just looks like really practical advice and kind of how we can collaboratively, address this topic. Jenny Reyes asks, is there any specific type of moisturizer for your feet that you recommend?
That's a very good question. So initially, I believe the over-the-counter type of moisturizers will work just fine. Because at the end of the day, what we're trying to do is just make sure that we don't have dry skin, which can lead to skin breakages, which can lead to infections. So moisturize daily. At this point, I don't have a specific recommendation as far as what type of brand, but we just want to make sure that when you moisturize, you don't put it in between the toes.
Gotcha. Now, does scented versus unscented, does that have any bearing on kind of the moisturizer, or it doesn't really matter?
It doesn't really matter at this point, but just bear with yourself when it comes to some people may have allergic reactions from different types of chemicals in the moisturizer. So just make sure you take a look. And if you start to see redness or if you start to feel that it's itchy, going with the unscented route might be a better way to go.
Gotcha, gotcha. So we have a couple questions that just came in. This is great. Do the things that you've discussed in this presentation pertain to individuals who do not have diabetes? I guess that's a question about the helpfulness of the advice to non-diabetic individuals.
Yes, yes. By all means, all this information is very beneficial for those who are non-diabetic. You know, the exercising, the checking your feet daily. And, you know, I mentioned before, you know, let's go ahead and try to wear white socks. The reason why I asked and I mentioned that was it can be another way of looking at your foot. Some people have, it's difficult to see the bottom of the feet. So the white socks can be an indicator if there's an open lesion or something. If you see that there's just a tint or stain that's a little different, it can just help you see if you need to take care of other things. But in regards to, does the recommendations help individuals who are non-diabetic? Absolutely. Exercise is very important, and making sure that you have ample blood flow to your lower extremities is extremely important as well.
Great, wonderful. We have a few more questions. This one comes from Evan. What are some ways to connect to Black men in Philadelphia, especially in the neighborhoods with the highest rates, to better inform and encourage them to get checked for and take care of their diabetes?
I think that is a fantastic question. And from my point of view, I think the first line is always education. I think talking about it is something that maybe needs to happen a lot more. If Black men talk amongst ourselves, about how we're doing overall, talking about if individuals are diabetic or not, or even just discussing going to the doctor and just being okay with that topic. I think this is something that if we can make this more mainstream when it comes to Black men talking about their individual health, that can lead to individuals making better connections and then leading individuals to perhaps go and see a doctor. It's extremely important. And I think education, talking about it openly and having discussions amongst friends would be something that could help increase the chances of individuals seeking out a healthcare professional.
Wonderful. Yeah, education, access, and destigmatization is very important. Thank you for that. Another question we have is from Raphael. If you find that your LDL cholesterol is high, how often should you get it checked?
That's a great question. So if the LDL cholesterol is high, getting it checked with your primary care physician is the number one thing that you can do. And they will give you very good things to do when it comes to whether it's medications, or they can teach you about better choices for food intake. And they can also increase increase you wanting to exercise, telling you about exercising. It's extremely important to exercise as well. But I would say when it comes to having high LDL, at least going to see your primary care physician once or twice a year is extremely important, and they can give you better tips to managing that high LDL.
Wonderful, thank you. Our next question is, are there low-cost clinics available in Philadelphia for uninsured men to get physicals to diagnose diabetes? What can the health systems do to help? And this is a great question speaking to access.
Access to care, yeah, I agree. Access to care is something that is extremely important. And this is something that we actively want to figure out ways to increase and better. As of right now, I don't have a list of free healthcare clinics that individuals can go to in order to get checked out, but that is something that I would like to figure out and help put together, and to increase the chances of individuals going to these free healthcare clinics. I don't have a list right now, but that's something that I definitely want to work on and possibly release so that other people can figure out where to go and get that checked out. But that's definitely something that is necessary and needed.
Great, thank you. Oh wow, more questions. This is tremendous. Thank you for being such a wonderful audience, by the way. This is great. Is there a correlation of amputation with those experiencing homelessness and those who are using drugs and alcohol? In my work, I have come across that with Black men and amputations. Is there a direct correlation with this?
Could you tell me again the what direct
Is there a
correlation?
correlation with
Correct.
homelessness and drug use and amputations?
So the statistics that I've been looking at right now, we're taking from, in fact, let me give you my reference page. What we did was we went to the inpatient hospital databases and we were able to look at amputation rates secondary to like surgeries that were done. And based off of the numbers that I got, it was from individuals getting surgery, but we weren't able to delineate specifically why they were getting those surgeries outside of if they were diabetic or not, or things like gangrene. Because what typically happens is you get something called a diagnosis code, and then those diagnosis codes can help, you use those statistics ranging from those diagnosis codes to paint a picture. So I don't have the statistics to tell me whether or not an individual who ended up getting an amputation was homeless, but we have the statistics that told us whether or not they were diabetic, and then that led to an amputation. I hope that helps with answering that question. I don't have that type of data just yet to hone in and figure out if individuals who are homeless have higher rates of amputation secondary to diabetes in comparison to individuals who are not.
Cool, thank you. So, well, the questions just keep coming in. This is tremendous. Is there any research in regards to gestational diabetes and long-term effects for Black women? Are gestational diabetes included in the previous data provided?
That is a very good question. I don't believe gestational diabetes was specifically included in this, but that is a very good question. And the question that I would also see is individuals who have gestational diabetes, like how long would that last? And does that lead to poor circulation to the point of needing amputation? So those are very good questions, but I'm not sure about the answer to those questions.
Wonderful, thank you. Do you believe the lack of healthy food in Philadelphia neighborhoods has something to do with the high numbers of amputations?
That is a very good question. And you know what? They talk about something called like food islands, right? And I do think there is a correlation between food islands, access to good, healthy foods, and the linkage to diabetes. So I would go out and say, I think there is a correlation between those. And the other aspect of it is choosing the right foods to eat as well. So access to good food plus choosing the right foods to purchase and eat, I think could help delineate between individuals who are diabetic and individuals who are diabetic and uncontrolled. So yes, I think there is a correlation between the two. Yeah.
Very cool. So that is more or less it for the typed questions. I wanted to go back a question because it looks like we have someone from PHMC who kind of sent the attendees group message. So she's saying that she, at PHMC, they have clinics that will gladly help folks. In addition, I want to add that Philadelphia Fight, along with PHMC, we do similar work. We also have clinics as well that will help folks who are uninsured and underinsured. So there are a number of resources in Philadelphia. So definitely check us out. So yeah.
Fantastic. Thank you for that.
No problem. No problem. I definitely think that a lot of the work that healthcare centers have to do is, in working with doctors and experts like yourself, is also ensure that resources are provided in tandem with the education. Education and access, like I always say, is key. So I think, yeah, thank you for this vital presentation. But before we close out, our intern over here actually has a question for you as well. So
Sure.
Oh, yeah. So I was curious to hear a little bit more about, can you any of the correlations or causes for higher diabetes and higher rate of diabetes in Philadelphia rather than other cities?
That's a very, very, very good question. Now, at this point, the things that I would say would probably just be from me thinking out loud. I don't have, specific data backing up what I'm saying, but I think some of it could be the type of foods that individuals love to eat and always come back to time and time again, maybe high in saturated fats, cholesterols, sugars. And then the other thing I want to mention is the amount of people who are exercising on a consistent basis to the point where it's part of what they see as their natural makeup. So this is just what I do. I go to the gym like 5 times a week. I go at least 30 minutes a day, and it's part of my daily routine. If I'm not doing that, then something is off. I think it has to do with food that individuals are eating, as well as what they consider to be part of their normal everyday routine.
Thank you.
thank you so much. Wow, the gym 5 times a week, that is yeah, rigorous. But wow, more questions are coming through. I can't emphasize how tremendous this is. So do we have demographic data on percentages of individuals who work in labor capacity, standing all day, upright, active?
I don't have that data just yet, but these are great questions because it can help lead me to ask new questions and then provide more statistics and more lectures in the future. So that is something that I would like to look into, the types of work that one does and the amount of hours that they have to do certain jobs. Does that lead to higher incidences of diabetes if you're not as active? Let's say you're sitting down for hours upon hours in a day, and your work doesn't really allow you to go out about, walk, get more steps, that sort of thing. Yeah, I think that may have something to do with it as well. A very good angle. That's a very insightful question, and that's something I would like to look into in the future.
Definitely. That is a really good question to think about, as someone who used to work in the food service industry, it leads you to think about activity, kind of persistent activities and how that affects someone's health, as opposed to just kind of like a stagnant activity, like sitting at a desk all day. So one more question, and then I think we can close this out. So the very last question is, are there other persistent diseases that appear along with diabetes in the African American population in Philadelphia, heart disease, etc.?
So my specific topic was just talking about diabetes, but heart disease, I believe, may be consistent with diabetes as well. But I can't say that definitively because I did not look into that specific question with my data either.
For sure, for sure. Cool. So I think that concludes all the questions that we've gotten in so far. So I just, before we close out, I just wanted to thank you, Dr. Marsland, for presenting this information. I think it's good. I think it's incredibly helpful, and incredibly useful to a wide audience, giving us practical, resources and strategies to combat, lower amputations. So I think collectively we can work on this issue in Philadelphia. So thank you so much.
You're welcome. And this is something that is near and dear to me. And I tell you, if we take these general steps, I fully believe that we can help lower amputation rates. And at the end of the day, that's what I want. I just want more people to lower amputation rates, period.
Wonderful. Thank you. Thank you so much, and have a good one. Take care.
You too.